One of the most talked about topics regarding infant health is tongue ties, and now more than ever, it's getting the blame for countless other pediatric health conditions. So many questions surround this topic, so in this video, we'll break down the science behind why your baby's tongue tie exists, and not just the potential difficulties that they can cause with breastfeeding, speech, and neurodevelopment. We'll go way deeper than most other providers do, and we'll investigate why we're seeing so many of them in our practice today, and what the true root cause of all of this trouble may be. This video is for parents, moms especially, who are wondering, one, if their baby has a tongue tie. It seems like every practitioner has a different opinion on severity and prevalence. And two, is this the reason that they're struggling with latching, uncomfortable nursing, gaining weight, colic, reflux, and even overall comfort? We're going to talk about potential causes of tongue ties. We'll look at the connection between prenatal development, the birth process, and the increase in prevalence of tongue ties. And most importantly, we're going to give you the best care options to address the cause of tongue tie. If you've got a mom friend who is trying so badly to breastfeed, but the pain's toe curling, or the baby is just too uncomfortable and frustrated to latch, then this is the video that you need to share with them, okay? This topic in particular, it hits real close to home for me. Our first child, Brooks, he was born by a cesarean, and although he was able to nurse immediately, his latch was intense. He struggled with maintaining a tight latch, so there was way too much movement between my breast tissue and his mouth. I developed blisters within the first week, and most of our nursing sessions would end up with blood. It was absolutely miserable. Being a chiropractor, I knew that a poor latch could be caused by altered neurology and biomechanics in the neck and in the jaw, especially with C-section and vacuum babies. So Brooks got adjusted every single day. He also had a fairly severe lip tie, which caused his upper lip to flange under when he latched, which wasn't helping us at all. But I was 100% committed to breastfeeding with him, and I am not gonna lie, there were so many moments where I was sobbing and I wanted to give up. But once that tension in his neck and jaw started to go away with each adjustment, his latch relaxed, and I was no longer dreading nursing him every single time. Also, the lip tie that I just told you about, that actually loosened all on its own as his neurology relaxed, so pretty cool there. Let's get into the science a bit behind tongue ties. A tongue tie is actually a condition where a strip of tissue that anchors the tongue to the floor of the mouth, it's too short, and it restricts movement and function of the tongue. And that can make it difficult for the baby to breastfeed effectively. So they might be unable to properly latch, to move the tongue into the jaw, and to draw milk out of the breast effectively. You may also commonly see this condition referred to as TOTS, which stands for tethered oral tissues. That actually includes the frenulum under the tongue, the lip to the gum line, or even the cheek to the gum line. So some babies with a tongue tie, they struggle to open their mouth wide enough to effectively latch and to breastfeed, which leads to difficulties with getting a complete latch around the breast or to stay latched for a full feed. This is super unsettling for a baby, and it can cause them to seem hungry all the time. They may not be gaining weight as quickly as they should, or another telling sign is also that clicking sound while they eat. It's actually the sound of an air gap being created as the latch is lost. So many of the signs and symptoms of a tongue tie will mirror those of colic, of neurogastric distress in a child. So it's often difficult to delineate between the two, and most importantly, what the root cause actually is of the child's nursing and sleep challenges. Is it a tongue tie that's causing the baby to struggle? Or is it something else? Let's talk about it. So to answer this question fully, we've got to dig into what is causing all of these tongue ties in the first place. So the traditional medical explanation will often attribute tongue ties to genetics, and that does appear to be part of it, but there's more to the story once again. So some natural health practitioners, they've connected it to mutations in what's called the MTHFR genes, and that's because the expression of that mutation, it alters folate absorption within the body, and folate is a vital nutrient for fetal development. Either too much or too little of it is known to cause midline defects, so that's things like tongue ties, stork bites in the back of the neck, sacral dimples, and in some severe cases, even some spina bifidas. Studies even suggest that increased folic acid intake, which is the form found in those cheap synthetic prenatal vitamins, and even found in tons of our processed foods now, may also be playing a role. As a pediatric chiropractor, we specialize in the neurology and neurodevelopment. The other holistic approaches do a great job at exploring those factors with soft tissues and with nutrients. But here's the key. The tone of the nervous system influences the tone of the muscles and the soft tissues. If the mom and baby's nervous system is stuck in a too tight fight or flight mode, it can affect a too tight frenulum, mouth, and jaw. While physiology and chemistry absolutely do matter, true health and true development always start with the nervous system. The nervous system's key in perceiving the environment within the body, outside the body, and then coordinating the cell behavior accordingly. So applying this to tongue ties, it becomes super clear how various issues can arise with this. Ultimately, tongue ties, like many conditions, are a combination of factors, right? A perfect storm of many, many factors. This perfect storm so often stems from a highly emotional fight or flight state of mom during pregnancy. And remember, baby's neurology is wired to mimic mom's neurology in pregnancy. And then this state is compounded by the birth process or delivery. So when babies have a physically stressful birth, it commonly includes two main components, right? Misalignment and fixation of a vertebra, leading to those biomechanical and musculoskeletal challenges. When we combine that with that in utero stress earlier, that neurological component quickly comes into play as well. In fact, I'll link a study below this. It was a study that found that 99 out of 100 healthy newborns had an incidence of somatic dysfunction, aka misalignment and fixation in their spine during the birth process. That caused an already stuck and stressed out cranial and oral system that started in utero to be further twisted and torqued, putting even more pressure on the baby's neuro-oral movements. So, your kid's got a tongue tie? What do? Many parents choose to have their child undergo a tongue tie revision surgery, often performed by a holistic pediatric dentist. This procedure is both crucial for both short-term and long-term well-being, considering that it does have effects on nutrition, neurological development, and even emotional bonding with mom. However, with that being said, like any medical procedure, there are factors to consider when making this decision for your child. If the baby experienced stress in utero, had abnormal fetal positioning, birth trauma, any of those things, that increased tension and thickness of the soft tissues may actually be a protective response to the entire neurological system. So here's the catch. If the tongue tie is surgically revised without considering that underlying tension and without consulting a pediatric chiropractor first, things may initially worsen instead of improving right after the surgery. We've seen this happen over and over. In this scenario, the original cause and neuromuscular tone that contributed to the tissue problem remains unaddressed. All the while, the child is also now having to cope with the pain and the tissue sweeps that often accompany the post-surgery recovery. It's a lot for those little ones to handle. So the key takeaway is this: before considering a surgical revision, measure the stress and tension in the baby's nervous system and help remove and unwind it along with the connective tissue revision. By doing this, we work together with the surgical revision, with the dentist, to lead to the best short-term and long-term outcomes for your child. We know that navigating tongue ties and potential tongue ties can be complicated and super complex, but we're here to help, okay? Last thing before I go, again and again, we find that a baby's tongue tie comes with moderate to severe tension within the nervous system. You'll see an example of this tension right here on this Insight thermal scan. This shows neurological interference right up here at the base of the skull. This was actually a kiddo who had had a tongue tie revision prior to starting care, okay? But we can see the tension still exists. We focus on this scan right here as it shows us exactly where the baby's struggling neurologically. Ideally, we're working on clearing this out prior to a revision because it'll help the healing go much more smoothly, or maybe the child won't even end up needing the revision in the first place. How cool is that? For more resources, guys, and info, check out the articles linked below. In the meantime, please reach out to us with any questions. We would love to help.